do oral medications, and specifically Dr. McGrath's combination therapy of a very high grade generic Propecia combined with Rogaine at 5 milligrams and combined with biotin, it doesn't work in the front. The answer is that the hair can improve in the front. There's no question about it. Let me show you by example of Avinash, who is featured on Dr. McGrath's YouTube channel, and where he started. So if we look at the picture of Avinash before, which is kind of shocking, 32 years old, he doesn't have much hair left on his head at all. As a matter of fact, he's pretty bald. So the reason why we wanted Avinash to get on the medication is because he's so young and he has so much surface area in the crown of his scalp. We wanted to actually make sure that there's not going to be any more expansion of the crown because he's only 32. He hasn't really established his lifelong balding pattern yet, although that's hard to imagine with that much hair loss. So what we did was we put him on the medication first for 6 months. And lo and behold, his after photo is absolutely incredible, and how much effectiveness and how much shrinking of the real estate back there and how much regrowth he got when he was pretty much a bald guy. That is absolutely incredible. Now keep in mind, he was bald. So anything he gets is called a net gain. I'm going to explain this momentarily, but sometimes this is a little deceptive. Not him or his hair, but guys that have more hair cannot see the results as easy. So let's take a look again at the front of Avinash. So here he is without anything really going on. And then here he is after 6 months. Now, Avinash was so blown away by his results from this oral combination medication that you can see it on a couple of his videos. He actually was smiling ear to ear, didn't even get a hair transplant yet, and has said to Dr. McGrath, hey, I haven't had a hairline in 12 years. This is incredible. So he considered that amount of growth an actual hairline. Good for him. So I think what gets a little confusing about results when it comes to regrowth in the hairline is that, if this makes any sense to you, the hair on your head, the entire head of hair, is going to become more quality overall. In other words, the hair in the donor zone is going to get stronger. The hair in the crown is going to get stronger. The hair over the ears is going to get stronger. The hair everywhere is going to get stronger. However, because the frontal zone does not respond as well as the rest of the head responding really well keeps the front kind of limited to what you're seeing, which makes it seem like you're not getting any progress. So really the only way to track it properly is to get really good photos, or go into your hair transplant clinic and get really good photos in a controlled environment with the same lighting. Because if I said to you, hey, listen, your hair in the front has improved 15%, or based on photography, something close to that, you might not think it because you're looking at it every day, but in reality, with the rest of your scalp responding at 15%, you're seeing everything kind of like an extrapolation of everything getting better, but the front is not catching up to everything else, which is, I think, what you want. So the answer to the question is absolutely, the combination therapy can work and help the front. If I had to determine the percentages of how much it will work in the front versus the rest of the scalp, it would be a low percentage. So Avinash is absolutely an anomaly, to say the least, because I've rarely seen a bald guy get regrowth in the front. So good for Avinash. But there you go, there's one example. But what I do know unequivocally is that the rest of the head will respond about 97% of the time, meaning your hair should improve. If the more hair you have on your scalp, the less you're going to see the improvement. So it all comes down to kind of what you see. But from a science standpoint, yes, the front of your scalp can improve, and can improve significantly based on those photos with Avinash with the combination medication therapy.